Hello, and thank you for your interest in the Tampa VA's Psychology Predoctoral Internship Program. My name is Dr. Jaime Winn, and I'm one of 4 psychologists in the Substance Use Disorder Service, SUDS. 3 of us are currently active in training. Together with a multidisciplinary team, including mental health counselors, social workers, nurse case managers, and psychiatrists, we provide a range of outpatient services for veterans in need of addiction recovery. In addition to psychology interns, we also host psychiatry fellows, as well as psychology practicum students who may participate in any aspect of our treatment services. Entry into our program begins with a referral to our daily orientation group, which can come from another provider, the patient him or herself, or even on a walk-in basis. Once patients are oriented to what we have to offer, they are presented with the opportunity to complete a full evaluation the same day or on another day of their choosing. After evaluation, they are then referred to the appropriate intensity of care and sometimes even begin treatment the same day. All patients are assigned to a counselor as the primary point of contact for their SUDS treatment team. Many also are followed by psychiatry, and psychology may get involved for the purpose of providing psychotherapeutic or testing services at any point in the course of a patient's treatment. The most intense level of care we provide is the intensive outpatient program, which consists of 2 hours of daily group programming that is based on a combination of cognitive behavioral therapy, mindfulness, social skills, and 12-step facilitation. We also offer aftercare and weekly outpatient group programming, which consists of group therapy utilizing CBT, harm reduction, mindfulness, and the simultaneous treatment of trauma and addiction. In addition, we have a weekly women's group, which is focused on emotion regulation and the recovery from trauma and addiction. We work with many court-referred patients as well who are in need of a range of services, often including a DUI court intervention program. And given that many patients with substance use disorders have difficulty with self-regulation across a number of domains, including emotion, cognitive, and interpersonal, we are now offering a full model SUDS DBT program, which consists of weekly group and individual psychotherapy for a 6-month time span. The typical intern may expect to participate in the delivery of group therapy interventions as part of the intensive outpatient program, aftercare programs, and outpatient weekly group programming. This is a very good rotation if you are interested in increasing your skills at providing group therapy. It is also a good rotation for individual psychotherapy, and the typical intern follows 2 patients throughout the course of their rotation. For interns who may still want SUDS experience but choose not to do the full rotation, following core psychotherapy cases from SUDS for the training year may be a good option, and I provide supervision for that, as well as my colleagues Dr. Jones and Dr. Arno. I am the primary supervisor for the SUDS rotation, and my colleagues, Drs. Jones and Arno, provide supportive supervisory services. Dr. Jones is a former SUDS intern and graduate of our hospital's internship program. She has a strong background in both DBT and ACT, and she built a DBT program within SUDS this past year. Dr. Arno has a strong background in personality testing using the MMPI, and he also offers CBT for depression and insomnia, and prolonged exposure for PTSD, among other things. As supervisors, we all value trainee growth and development and strive to help you fill in the gaps in your training and to achieve a grounding in evidence-based therapies for the treatment of substance use disorders. You may expect to become familiar with motivational enhancement as a guiding principle for approaching SUDS patients at various stages of change. You will also gain familiarity with CBT and mindfulness-based approaches to treating addiction, among others. For individual psychotherapy, referrals often pertain to trauma and depression recovery. You may learn evidence-based therapies such as cognitive processing therapy for PTSD or interpersonal process therapy for depression to address those concerns. As psychologists on the team, we are regularly called upon to help clarify diagnoses for complex patients using psychological testing methods in diagnostic clinical interviews. As a primary supervisor on the rotation, I value a collaborative and egalitarian approach to supervision and seek to support trainees as they develop their own styles for psychotherapeutic intervention that is grounded in an evidence base. My own theoretical orientation has become largely mindfulness-based over the past few years as I've become more familiar with those techniques and applicability to a variety of concerns, and most especially the need for emotion regulation and recovery from addiction. I also highly value the therapeutic relationship and the common factors that promote recovery. I know many trainees may not be planning on careers in the addiction field yet, though you may expect to encounter patients with addiction concerns in a variety of settings in your career, and it is a very good idea to gain exposure, familiarity, and comfort in helping those patients in what may be your final year of training. I will be happy to answer any further questions as needed, and good luck with your search for the best fitting internship you can find.